Did you know that there's a new option for ACL injuries that doesn't necessarily involve a traditional graft or reconstruction? It's called the BEAR procedure, which stands for Bridge Enhanced ACL Repair. Instead of reconstructing or replacing your torn ACL with a tendon graft, the BEAR technique uses a collagen implant to bridge the torn ends of your ACL. This unique approach actually allows the ligament to heal itself. Studies are showing promising results with really good outcomes and great recovery in many cases. The BEAR is a great option, especially for athletes, young and old. If you're dealing with an ACL injury, you might want to look into the BEAR surgery to see if it's right for your type of ACL tear.